Today we're going to be talking to everybody's favorite doctor of physical therapy, ChatGPT. So what we're gonna do is we're gonna ask ChatGPT to give us a low back pain program, see what it comes up with, and see if it's good, bad, somewhere in between. So let's get started. Let's ask it. Make me a program to help me with back pain. Okay, and here we go. Dr. ChatGPT. So it does take some time to ask 5 good questions here. Where exactly is your pain? It's good to know, I guess. Lower back, mid back, or upper back. I didn't specify that. What triggers or worsens it? Okay, what movements are going to make it worse? Do you train, exercise regularly? Do you have any known injuries? And what equipment do you have access to? So those are probably good questions. Once I have that, I can tailor a plan with specific exercises. Let's say I have low back pain. Let's just say that's probably what somebody might say. And they say, since it's low back pain, I'll give you a gentle but effective starting program focused on 3 goals: reducing pain and stiffness, improving mobility, building strength and control around your core and hips. So not bad goals. Okay, thank you, ChatGPT. Now, let's look. Daily low back pain relief, beginner friendly. Frequency, do this 1 to 2 times a day, especially after waking and or before bed. Takes 10 to 15 minutes. All right, spinal mobility, step 1, 2 to 3 minutes. We're gonna start with a cat-cow stretch. It tells you a little bit how to do it. Essentially what this exercise is being on all 4. You are making yourself like this, and then like this. So you're extending, and then you're flexing repeatedly, working on mobility of the spine. To be honest with you, I don't love this one. I don't use it with a ton of patients. Typically, it's not tolerated super well, and you just really tend to move through areas that are more painful when we should rather be protecting those in the early stages after an injury, depending on what the injury is. The number 2, pelvic tilts and supine. Really all a pelvic tilt is when you either bring your hips back like Donald Duck butt or forward to make your back flat. So you're just tilting your pelvis, moving it. You're really going to get a lot of low back mobility while you're doing that and movement through the low back. So it's funny that ChatGPT would put both of these on the spinal mobility step 1, because really I'm not going to use these with you. Definitely not. Because I just don't, the pelvic tilts are really kind of an irrelevant exercise because nobody's walking around like that going Donald Duck butt, flat butt. You know, they're not doing that. So I don't think it really does much for us in terms of reaching the goal that we're after here. Moving along, step 2, core activation, 4 to 5 minutes. Dead bug in parenthesis basic, whatever that means, whatever basic means for them. 2 sets of 6 to 8 reps aside. Telling us how to do it. Ooh, there you go. So it says without arching the lower back, which is something that a lot of people do when they're doing the dead bug. If they don't push their low back down in the ground, or at least focus on that cueing, then their low back is going to arch as they're doing it, and they're not going to have that stability that we're after during that exercise. So good job, ChatGPT. You know how to coach so well. Bird dog, kneeling. 2 sets of 5 to 6 reps aside. On hands and knees, extend opposite arm and leg. Hold it 2 to 3 seconds. Keep your hips steady. So in this case, bird dogs are fine. Bird dogs are probably one of the most commonly given exercises. You might have seen the McGill Big 3 before, or pretty much any other low back pain program you might Google. You're going to see a bird dog, and that's where you raise that opposite arm and leg. And one little tweak that I like to use that makes this way more effective is instead of just like raising your leg up off the ground, first try to straighten your knee all the way, and then think about just raising your heel up to try to hit the ceiling, just the heel. And when you do this, you don't need to move quite as far, but you should feel a lot of glute and a lot of hip working during this movement versus when you might be doing it typically where you don't do this cue where you might not feel as much of the hip, and you might feel a lot of low back if you've been having back pain. And now we move on to step 3, hip and glute strengthening. Okay, so this is all in the same workout here. All right, we got a glute bridge, and we got a standing hip hinge wall tap. So here for the glute bridge, there's really nothing wrong with the glute bridge itself. It's a great exercise. I really wouldn't have a problem with you doing them. Sometimes a single leg can be a little bit better when you're having low back pain. So that's one tweak I might make. The sets and reps, or the reps are a little bit high here. Likely, if you have low back pain, your glutes don't work as well as they probably should. So 12 to 15 reps, you're going to be getting into a lot of compensation at that point. I would really focus on maybe 4 to 6 reps at a time. Maybe do some more sets, but at least focus more on the quality of those reps rather than trying to just crank out 15. Because at this point, movement quality is way better than movement quantity. So if you do 5 reps, but they're amazing, it's way better than doing 36 reps that are just, or 30 reps, 2 sets, 15, that are just complete garbage. So think about that when you're doing a program, especially if you're doing a ChatGPT program. All right, the hip hinge with the wall tap. You're going to stand a few inches from a wall, hinge your hips back until your butt taps the wall, and then come back to standing. It's a fine exercise, but to be honest, I don't think you're going to get the results that you're looking for. So in this case, the tweak that I would make to this ChatGPT back pain program is to make it a single leg hip hinge and do it, forget the wall. You don't necessarily need that cue, but to go where you're holding on to a rack or a couch, something next to you that's going to take away the balance problem and just let you focus on moving through the hip. Now a hip hinge, now I'm going to go out of the frame a little bit, but you're going to stand on one leg, and then your heel and head should have a straight line. Of course, I run into the table. So it should be a straight line head to heel, and you can hold on to something because, like I said, your balance is probably going to go first before it'd be hip strength. But we're working on the outside of the hip here when we do this and the back of the hip. So a lot of glute, the different glute muscles, we're working with that one. I just like to do a lot of single leg work initially with people. That's just more of a personal preference. Again, there's absolutely nothing wrong with that exercise. It's just a tweak I would make to it to make the ChatGPT program a little better. The AI is going to be very mad that I thought that I could do it better than it can. And now an optional cool down, a child's pose or a knees to chest stretch, and gentle breathing in a comfortable lying or seated position. Okay, so child's pose is a position where you're basically going to be bent over, got your arms up over your head, you're on your knees. It's usually a pretty comfortable position unless you have a problem with your back that doesn't like flexion very much, which is bending forward. So, just keep that in mind if you were to do that exercise. Knees to chest is usually much more tolerable, especially if you do a single leg, but holding. I don't know why I said that. Usually the knees to chest stretch is a little more tolerable than the child's pose if you have issues with bending forward. So in that case, then the tweak I would make here is just to go single leg again. So only pulling one leg at a time and pulling it up towards your chest. And you're going to get not only a stretch in your hip, which is likely a problem with back pain. Good chance you have a hip mobility issue. But you're also going to get a little bit of a decompression of the nerve in the spine, because when we flex, it does give us some relief there. So if you are having a thing called a radiculopathy, that is usually helped by exercises that can open up that little area where the nerve comes out in the spine, and a single knee to chest can do that. Hopefully I didn't lose you all there. Tried to make that simple, but of course, sometimes how things sound up here versus how they come out, way different. Anyways, gentle breathing, always going to be a good idea. Diaphragmatic breathing is something great that you can do if you have back pain. That is a wrap. That is what ChatGPT came up with when I asked it to make us a home program. Do I think it's the worst thing ever? No. Do I think it's great? No. Do I think it's somewhere in between? Yeah. Probably going to be okay to help you get started. I don't like a lot of the exercises. I think they're either a waste of time or they're going to be non-specific. And that's the problem with this. But we already know that ChatGPT asked us to give us a little more answers to the questions, and we didn't give a ton. So do I think that it would have been much better if we gave it answers to the questions? I don't know. Maybe we'll try that on another day. But you probably don't want to see me talking to ChatGPT more than I have to. Or you have to. In short, though, if you are having back pain, please go see a professional who deals with this stuff. Don't rely on the internet, because there are so many questions that need to be answered when it comes to back pain. Not all back pain is the same, and it shouldn't be treated that way. So if you are struggling with back pain for a while and you just aren't getting anywhere, you're trying everything you see on the internet, it probably is time to try to get some real professional help. My goal with this channel is to make sure that you do not quit the things that you love, whether it's sports, training heavy, playing with your kids. We're going to keep you doing that, and we're going to get you there pain-free. So if you felt like this video helped, make sure to hit the follow button or share it with somebody who needs some help with their back pain. And we'll see you on the next video.